Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. For those who don't know me, I lead advocacy and policy here at GHLF. I'm a lawyer by training, a professor, and also someone navigating this healthcare system alongside you. And today, we're talking about something bigger than one vaccine, one agency, or one headline. We're talking about trust, because right now, something important is happening inside America's public health system. Federal health agencies are changing how they communicate about vaccines, how they review studies, and how they make recommendations. Scientists are raising concerns, public confidence is slipping, and patients are increasingly caught in the middle trying to figure out what and who to believe. This month alone, the FDA declined to review a new Moderna flu vaccine application. Reports emerged about delayed or blocked vaccine safety studies, legal fights over vaccine recommendations continued, and new polling showed declining confidence in several vaccines. At first glance, those might sound like separate stories, but together, they point to a larger shift happening in public health right now. So today, we're going to connect the dots. What's changing inside federal health agencies? Why scientists and advocates are concerned, why supporters say these changes are necessary, and what all this means for patients and families. Let's start with the FDA. Recently, the FDA declined to review a new flu vaccine from Moderna. The vaccine used mRNA technology, the same platform used in COVID vaccines. Now, this was not a rejection of the vaccine itself. The FDA said there were concerns related to how the study was designed and which comparison vaccine Moderna used in its trials. Scientific disagreements like this happen, but context matters. This decision comes during a period where vaccine-related products appear to be receiving heightened scrutiny under new agency leadership. And for patients, the issue is not really about trial design. It's about confidence in the process. When people hear a vaccine wasn't reviewed, studies were delayed, recommendations are changing, they naturally start asking bigger questions. Is the science changing? Are standards changing? Is politics influencing public health decisions? And those questions matter because public health depends on trust. The FDA recently also brought reports that federal officials delayed or blocked publication of several vaccine safety studies. According to these reports, the studies involved COVID vaccines and shingles vaccines and found that serious side effects were very rare. Administration officials reportedly argued the studies required additional review or had methodological concerns. Critics argue that withholding or delaying findings, especially findings supporting vaccine safety, can undermine public confidence and fuel confusion. And here's the difficult reality. Even when scientific review is appropriate, a lack of transparency creates uncertainty. Patients do not see the internal methodological debates. They simply hear a study was blocked, and in today's environment, that alone becomes part of the story. At the same time, polling shows confidence in several vaccines is declining. Most Americans still believe vaccines are safe. That's important, but trust in the flu vaccines, MMR vaccines, and COVID vaccines has declined over the last several years. And that decline is happening during massive outbreaks of measles, an ongoing COVID circulation, and a recently severe flu season. So what's driving all of this? It's not just misinformation, it's inconsistency. When messaging changes, when recommendations shift, when agencies appear divided, when politics and science become harder to separate, people lose confidence. And once trust erodes, rebuilding it becomes very difficult. One of the biggest changes happening right now is the move toward more individualized vaccine recommendations. Instead of broad universal recommendations, some vaccines are increasingly being placed under something called shared clinical decision-making. We've talked about this on the program before. That means that patients and doctors discuss risks and benefits together and decide whether vaccination makes sense for that individual. Now, in some contexts, shared decision-making is absolutely appropriate. It sounds like a great thing, right? But critics argue that when a vaccine moves from strongly recommended to an optional discussion, patients often interpret that as the vaccine is less necessary or maybe less safe. It also puts doctors in a disadvantage as they don't want to expend energy, time, trying to convince a patient of something so critical as taking vaccines. That subtle shift can reduce vaccine uptake, even if the underlying science itself has not changed. That is one reason why public health organizations and medical societies are increasingly vocal right now. If any part of this feels confusing, you're not alone. Go to ghlf.org and sign up for our free newsletter. We break these issues down in plain language and explain what they actually mean for patients and families. You do not need to spend hours following FDA policy debates and scientific controversies. That's our job. But you deserve clear information when these decisions affect your health. Back to the show. Stepping back, this is about much more than one vaccine or one study. We are watching a broader transformation in how federal health agencies approach evidence, risk, communication, public trust. Supporters of these changes say agencies are restoring vigor, asking harder questions, and moving away from automatic deference to pharmaceutical companies. Critics worry the opposite is actually happening, that scientific norms are becoming politicized, communication is becoming inconsistent, and public confidence is weakening. And for patients, this creates a difficult environment. Because most people are not reading clinical trial protocols or FDA briefing documents. They're simply trying to answer, can I trust the system that is supposed to protect my health? So what should patients take away from all of this? First, do not confuse policy debate with sudden scientific collapse. Vaccines that have been studied for years did not suddenly become unsafe overnight. Second, recognize that public health guidance is becoming more complicated and more individualized. That means conversations with trusted healthcare providers matters more than ever. And third, stay informed from credible, balanced sources. Because when trust becomes fragile, clear communication matters enormously. Public health depends on more than science alone. It depends on credibility, consistency, and trust. Right now, all three are being tested. And whether these changes ultimately strengthen public confidence or weaken it may depend less on politics and more on whether patients feel they are getting honest, transparent, evidence-based information. That is the challenge facing public health right now, and it's one we'll continue following closely here at the Health Advocates. If you want to take a step further, join us at the 50 State Network. You can sign up at 50statenetwork.org because health policy does not just happen inside agencies and courtrooms. It affects real people making real decisions every day. Thanks for listening to the Health Advocates. If this episode helped you understand what's happening, share it with someone who needs it. And if you have thoughts for us, leave a comment down below. We'd love to hear from you. To stay informed on all the policy information you need, click the button below that says subscribe. It's totally free to you and lets you stay up to date when new episodes come out each week. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.